Popular Diets for Weight Loss and Health, developed by Dr. Jenna Anding, Associate Department Head for Extension, Professor and Extension Specialist, Department of Nutrition, Texas A&M AgriLife Extension Service. Presented by Monica Aguirre, Prairie View A&M University Cooperative Extension Program, Bexar County Family and Community Health Extension Agent. Let's talk about dieting. The craze is the low-carb diet, or diets. What are they? What does the research say? Should I try the diet? What else can I do for weight loss and health? What are carbohydrates? Carbohydrates are a nutrient made of carbon, hydrogen, and oxygen. They're our main source of energy. They're found in grains such as rice, oats, and wheat. They're also found in vegetables, fruits, dairy. They're found in sweets and desserts, in our sweetened beverages, and honey and sugar. They're everywhere. They're described as either whole grain, minimally processed, or refined. How many carbohydrates do I need? Current recommendations are about 45 to 65% of our calories. This is in a 2,000 calorie day. That equals to 225 to 325 grams of carbs. Currently, about half of our calories come from carbohydrates. We are encouraged to make our carbs come from vegetables, fruits, legumes, and whole grains over the refined sources like cookies and candies and sweetened drinks. Carbs aren't getting a lot of love these days. Are they bad for us? Are they good for us? What kind of carbs do we need? What is the public perception of carbohydrates and weight gain? In a national survey of 1,009 adults, 1 in 3 identified sugars as the cause of weight gain. 1 in 4 identified carbohydrates as the cause of weight gain. 36% reported following a specific eating plan or being on a diet. 1 in 6 were following a low-carb type of diet, such as Keto, Paleo, or the general low-carb diet. Let's look at the following diets. Low-carb diet, a general one, Ketogenic diet, and Paleo diet. Let's look at the 4 whats. What's allowed? What's not allowed? What does the research say? And what should I do if I want to try this diet? Low-carb diets. No standard low-carb diet. Moderately low-carb diet. That is 30 to 40% of your total energy intake. That is less than 130 grams of carbs per day. The very low-carb diet, that is 20 to 70 grams of carbohydrates per day. And then there's the ketogenic diet, which is 5% of your calories come from carbohydrates, and very high in fat, which is 75% of your calories. Remember, the recommended range for carbohydrates by the dietary guidelines for Americans is 45 to 65% of our calories should come from carbohydrates. Low-carb diets. What's allowed? Meat, fish, shellfish, poultry and eggs, nuts and seeds, non-starchy vegetables, some dairy like cheese or yogurt. Some plants allow small amounts of fruit, other vegetables, and whole grains. This list has examples of non-starchy vegetables, such as broccoli, carrots, cauliflower, onions, peppers, turnips. The list is quite extensive. So let's look at what's not allowed in low-carb diets. Bread, crackers and chips, pasta, potatoes and corn, rice, cereals and grains, fruit may be allowed in small amounts, and legumes. It won't take long to reach your carbohydrate limit on a low-carb diet. If in a moderately low-carb diet, the carb amount that you intake per day is less than 130 grams, Look at a banana, 20 grams. Only 1 cup of brown rice is 45 grams. 1 medium apple, 25 grams. 1 cup of pinto beans, 45 grams. So it's very easy to reach that limit of carbohydrates per day in a low-carb diet. What might a low-carb meal look like? If you notice, it is significantly high in protein and vegetables, and there's also a high level of fat. What does the research say about low carbohydrate diets? Compared to a low-fat diet, a low-carb diet may produce more weight loss in the short term. Long-term weight loss is about the same. A Mediterranean diet that is low in carbohydrates may lead to a greater reduction in waist circumference and body weight compared to a general low-fat diet. Compared to a low-fat diet, a low-carb diet may lead to greater weight loss and increased LDL, a risk factor for heart disease. Women of childbearing age who cut carbohydrates consume less folic acid and may have an increased risk of giving birth to a child with a neural tube defect. Low-carb diets may be lacking in key nutrients such as folic acid, vitamin B6, thiamine, calcium, potassium, and dietary fiber. Advice if you want to try a low-carb diet. Talk to your doctor, especially if you have diabetes, heart disease, or any other medical condition. A low-carbohydrate diet may help jumpstart your weight loss journey. Research into the benefits for treating certain diseases is underway. Following this diet long-term can be difficult for some people. Long-term effects of a low-carb diet are not known. A low-carb diet may be lacking in important nutrients. Supplementation may be needed. Try to include fruits, vegetables, and whole grains to assure nutrient adequacy. Let's look at the ketogenic diet. It limits carbohydrates to 20 to 50 grams per day. That's less than 5% of your daily caloric intake. Protein content is high enough to spare lean body mass. Lack of carbohydrates causes the body to use fat for energy. It produces ketones which build up in the body. People may track ketones in the body by using blood, prick meter, or urine ketone strips. It may take a week or longer to get into ketosis. This diet recommends approximately 20% protein, 5% carbohydrates, and 75% fat. What is allowed in a ketogenic diet? Meat, poultry, fish, shellfish, eggs, cheese, butter, mayonnaise, non-nutritive sweeteners or artificial sweeteners, leafy greens, broccoli, cauliflower, celery, oils, creams, and nuts. What's not allowed in a ketogenic diet? Fruit, peas, corn, potatoes, peppers, onions, tomatoes, legumes such as dry beans, peas, and lentils, grains, sweet sodas or desserts. What does the research say about the ketogenic diet? It's been used for decades to help treat pediatric seizure disorders. For some people trying to lose weight, a ketogenic diet may be more effective than a low-fat diet. It may help with blood glucose control in individuals with type 2 diabetes, but more research is needed. Very few well-controlled studies have been done, and they've been done in a small number of people for a short period of time. Could ketogenic diets be used to treat other conditions? Ketogenic diets are also being studied as a possible treatment option in patients with other diseases, such as polycystic ovarian syndrome, some forms of cancer, and other neurodegenerative disorders, such as Parkinson's and Alzheimer's. However, no conclusive data has been gathered to warrant a recommendation. Many of the clinical trials involving ketogenic diets involve small population sizes, or animals, for short periods of time and cannot generalize the results to a wider population. Possible adverse effects of a ketogenic diet. Short-term side effects would include nausea, vomiting, constipation, dehydration, also known as the keto flu, loss of appetite, hypoglycemia. Long-term possible side effects would be disruption in lipid metabolism, fatty liver, mineral deficiencies, and kidney stones. Advice if you want to try a ketogenic diet. Talk to your doctor first before trying a ketogenic diet. It should be monitored, especially if taking medication for diabetes or other illnesses. Supplementation may be necessary. The diet is not for people with pancreatic disease, liver or thyroid problems, eating disorders, who have had gallbladder disease or have had their gallbladder removed. Levels of carbohydrates, fat, and protein is drastically different from the typical American diet. Focus on healthy fats. Long-term adherence can be a challenge for some people. Now let's explore the Paleo diet, also called the caveman diet, the Stone Age diet, or the Paleolithic diet. It mimics how people ate in the Stone Age. The theory is human beings stopped evolving 10,000 years ago, so we should eat like people ate 10,000 years ago. What's allowed in a paleo diet? Grass-fed beef, wild game, fish, shellfish, poultry, free-range eggs, organic fresh vegetables and fruits, nuts and seeds, and non-GMOs. If you can hunt it, fish it, or gather it, you can eat it. What's not allowed in a paleo diet? Grains, cereals, dairy, legumes like beans or peas, or peanuts, refined sugar, processed foods, refined vegetable oils, salt. If you can't hunt it, fish it, or gather it, you can't eat it. What does the research say about the paleo diets? They're being studied as a possible diet to help blood glucose control in patients with type 2 diabetes. However, the studies are done on a very small population, not well designed. One study found that paleo diet produced more weight loss at 6 months compared to a control diet, but there was no difference after 2 years. Improvement in triglycerides levels continued past 6 months for those on the paleo diet. Other things to consider about the paleo diet. It is expensive. Whenever you see grass-fed, organic, or non-GMOs, it's going to cost more. Why eliminate food groups that have known health benefits, like dairy, whole grains, or fortified grains that have folic acid, legumes, which are rich in fiber, protein, and iron? It is not a diet for vegetarians or vegans, as soy and other legumes are not allowed. Long-term effects are unknown, and long-term adherence to the diet may be a challenge for some. In summary, no single type of diet works for everyone. Low-carb diets can help some people jumpstart the weight loss process, but it is unclear of the benefits for those with type 2 diabetes. People with type 2 diabetes should be monitored by their physician if they want to try a low-carb diet. We need more good quality research to better understand the possible benefits of lower or low-carb diets. And keep in mind, when you eliminate food groups, you eliminate nutrients and the health benefits that go with them. What else can we do if we don't want to jump on the low-carb bandwagon? Well, for one thing, we can make smart carbohydrate choices. We can eat more vegetables, fruits, whole grains, and legumes. And we can eat less refined carbohydrates, sweets, desserts, and sugary drinks. Remember, our weight and our health is influenced by many factors, such as where we live, our health and medication use, Our genetics. Do we get enough sleep and rest? Are we physically active? What are we eating? And our family and friends influence the choices that we make as well. Remember, don't try to be perfect. Just try to be better than you were yesterday. Thank you for joining us, and we hope to see you soon.